Well, hello there. Happy Monday. And thank you for joining me for another episode of your weekly dose. I am Laura Wilkerson, nurse practitioner, and I want to talk to you about how to have better conversations with your general practitioner. That might be a physician, that might be a nurse practitioner, that might be a physical therapist or a nurse coming into your home. But I want to talk to you about the things, if you're a caregiver, those discussions that you need to have with your primary care. It can be really difficult when you're already stressed out, when you're feeling burned out, when you're feeling frustrated, fatigued, or tired, to remember all of the things that you need to talk about with your person with dementia. You need to talk to their primary care physician or nurse practitioner about. So some of the things that when I am in a visit and I might be seeing somebody for the first time, these are the things that I bring out of the families. Or if somebody's able to still speak to me directly and I can communicate with them, these are the things that I like to know and the things that I like to watch for in a person so that I can watch for change. Obviously, the more I know, the more specific and the better I can make a care plan for that person, and not just for that person, but one that fits for you, because it's very difficult caring for somebody if their plan of care doesn't fit for you and your needs. So one of the first things that I like to talk about is any behavioral changes, any shifts in behavior like increased confusion, agitation. Are they withdrawing? How are they acting in a social setting? It's a really good thing to take note of. And if you can't remember those things, certainly documenting them is really super important. Any memory loss, any changes, any lapses in memory, struggles to recall familiar dates, details, times, that's really important. I know sometimes when I'm in an actual patient interview, the family has already spoken with me outside of the room and they tell me, mom or dad or whomever I'm seeing has lost their ability to remember things. And then when we both go into the room and I'm starting to go through the PAT questions, those questions that are all lined out for us in our visit notes, the patient that I'm interviewing actually has really good recall. I cannot tell you why that happens, but there are times where a family member is like, oh no, that's not how she really is. She really doesn't remember every day what she has for breakfast. She doesn't remember who our president is. But if you write those things down and you document those, it makes it so much easier to discuss with your primary care. The number 3 thing that I think that I know that I like to talk about is changes in their daily functioning. What were they once able to perform that they can no longer perform independently? You might not notice this one as drastically unless something happens like where your person has had a stroke and they were independently, cooking their meals or they were driving themselves to work or those kind of things, and then suddenly they ceased. But what you may notice is that your person is not brushing their teeth like they used to, or they're not body grooming like they used to. And suddenly you're having to give more verbal cues to your person. That's definitely a good thing to document and bring up with your primary care, because the more activities of daily living that you're doing for somebody, it means they're becoming more dependent. So that would be a significant change that I would want to know, and that I'm certain that your PCP would want to know as well. Any changes in communication. Is your person finding words difficult to remember? Are they repeating? And you'll remember that one because it probably is the one that gets on your nerve the most, is when they're constantly repeating. When are we going to dinner? When are we doing this? What time did I do that? What time are we leaving? When am I going home? is your person having trouble expressing their thoughts? So you ask them a direct question, but it's taking them a while to respond. Or maybe if they're having problems forming their words, such as in expressive aphasia, you may ask them a question, but they might tell you that their belt buckle is inappropriate, or that their shoe is on wrong. And you weren't asking about their shoes, or you weren't asking about their belt buckle. So are they finding words difficult? Are they grasping? Are they reaching? Are they being repetitive? Or are they having trouble expressing their thoughts? Are they having any changes in their emotions? Are they having mood swings? Do they wake up one way and then within a few minutes they're depressed or they're anxious? Or are they emotionally distraught? And not only are they having those things, but when are they happening? Because those of you who are in the thick of it with dementia, you know that when that sun goes down, that your person can change pretty dramatically if they have sundowning. So if they're having the behavior or a mood swing, and what time are they having it? That's a great thing to document. It's something for somebody to tell me, mom is acting depressed, or mom is acting anxious, or her mood is emotional such that she's crying, all the time. Well, is it really all the time, or is it happening in the morning because you woke her up and she wasn't ready to get up? Or is it happening in the evening once that sun sets and the shadows are starting to be cast into your home from street lamps or lights outside of your home, and that's mentally disturbing to your person and causes them some distress? So are they having mood swings, emotional swings, and what time are those happening? It's a great talking point with your PCP. Another thing that we often don't think about is sleep patterns. If somebody is sleeping greater than 12 hours a day, that's a problem. Are they shutting down mentally and emotionally, shutting out the world? Or is their body shutting down? And that's another sign to us as caregivers. Is their body shutting down? And so they're sleeping more because their body's conserving. So talking about your person's sleep patterns. Are they an insomniac? Are they going to bed easily but waking up during the night? And why are they waking up? Do they have excessive daytime sleepiness? And how many naps are they taking a day? And for what amount of time? Because if somebody's not sleeping at night, but you're allowing them to sleep, for 2 or 3 hours during the day, well, that makes sense. But if they're up and they're active all afternoon and they're still not sleeping, well, then maybe they need something to help them sleep at night. Maybe they need a better bedtime routine, or maybe they actually need a medication. But let's start with that routine first. Let's make sure we've got a good routine for them. Cut out the naps, get a set bedtime, get a set bedtime routine, and then see if there's a change in their sleep patterns. What about, their physical health? Meaning, are there any changes in their appetite? Are there any mobility challenges? Was your person once walking really well, but then all of a sudden you start to notice that they might be dragging one of their legs, or maybe they're having trouble getting up out of their chair, their favorite chair, the chair that they used to get up from all the time? But are they suddenly struggling to get up from that? There are things that we can do for your person, such as physical therapy, in home or outside of home if your person can still get out. So talking about mobility changes and changes in appetite are things that we often don't think about when we're talking with our PCP. I like to talk about medications, of course. That's really super important. What is your person taking? But not only what is your person taking, but are they taking it appropriately? This is a big one for me, because I know lots of patients who have lots of meds, but they're not taking them like they should be. It's very hard as a practitioner to adjust medications meaning increase them, decrease them, or even take them away if your person isn't taking them the right way. So if you're caring for somebody with dementia, mild dementia, and they're still able to take care of themselves at home, and maybe you're doing like a med setup, meaning you're putting them in the little pill containers or you're putting them in a machine and the machine's spitting out the meds, make sure your person's actually taking those meds, that they're not putting them in a cup and then setting them on their, their bedside table. And make sure that they're taking them all, because sometimes some people like to pick their medications out, like, oh, I didn't take the pink one today. Well, if I don't know what the pink one is when I'm speaking with you, I can't make adjustments in any medications without knowing they're taking the medication, they're taking it at the right time and for the right reason. Are there any safety concerns? Are you concerned about your person wandering? Are you worried about falls? Have they had any falls? Spontaneous falls that happen for no reason are of huge concern. If you have rugs or cords or those kind of things in your home or in your person's home, get them out, because it could put them at a fall risk. But if they're falling spontaneously, those are all things that we want to know. But sometimes when we get into the thick of conversations, we as providers even forget to ask that. So if your person has had falls or that they've had any issues with wandering, even if it's wandering around their house, that's something that we're going to want to know. Obviously, it becomes a safety risk. If they're living alone, then we want to start talking about Life Alert, or we want to start talking about other support systems to put in place for your person. Is it new living arrangements? Is it that they're moving in with you, or maybe you live with them, but you go out to the grocery store? We still need to get them a mechanism that they can alert you if they've fallen or if they've left your house when you least suspect it. The last thing that I think is really super important is, what support systems do you have in place? And I know this is a big one for all of you who are caring for your loved one, especially those of you that are children of of one of your parents and you're caring for them. I see it all the time. My siblings said that they would help, but then they're not helping me. Or my siblings said that they would help, and then they come to visit and all they do is criticize me for my choices or what I'm doing or decisions that I've made about mom, dad, aunt, whomever. What systems do you have in place? Because that's just going to make us all much more successful. If your siblings are active, then great. You be that point person, you disseminate out the information to them, and then that way we're all on the same page. If your siblings aren't supportive or only want to pick and complain about everything that you do, then we need to know that too, because inevitably at some point, one or all of them may call the primary care's office and start to talk about things that they don't think are right, or mom or dad should be on a new medication. And if we don't have that information from you as their power of attorney or as their primary support person, we may start to have conversations with them that conflict with all of the progress that we've made with you, with your person. So what support systems do you have in place? And if you don't have any, then what we need to do is find support systems, create support systems, because it is very hard to be a caregiver, and managing it alone, I don't think anybody should ever have to do that. Whether you're finding a Facebook group, whether you're finding a local Alzheimer's group, whether you're finding somebody in your church or ladies club or gentlemen's club or one of those other clubs that you might be able to still participate in as when you're a caregiver, finding you those support systems and putting them into place so that you feel supported. Joining Facebook Lives like this, where you get details and information on how to be a better caregiver, to know that you're not alone, to know that you're supported. These are great ways. But if you don't have support systems, if you don't have family support, or you don't have friend support, letting your primary care know that in advance is very helpful, because they can help you find support systems, or they could hook you up with a social worker who could help you find support systems. I gave you 10 different things that you could talk about during your primary care visit. Now, you don't have to talk about them all at once, because not all of them may be important all at once. But if your primary care hasn't asked you about one of those kind of things, don't let it pass you by. Make sure that you either document it and give it to them if there's no time to talk about it in a visit. Like, here are some of the concerns that I had that we didn't have time allotment to talk about. So maybe our next visit is a bigger one. Or if your person is homebound, find a practice like the one that we have here with Advanced Medical that comes into your home. That is a great opportunity for a primary care provider to see how your person functions in their own home. Like I said, excuse me, your person may be able to go to the doctor's office, and in 10 to 15 minutes that they spend with their primary care, they may be able to pull off very strong. But seeing a person in their own home and how they function in their home, and being able to ask questions over and over again, but maybe phrasing them a little bit differently, eventually somebody with cognitive disorder is going to get caught. They're going to get caught in their language pattern, or they're going to get caught in their memory pattern, to where in the home you'll be able to pick up on that much better than if you were seeing them in the office. Effective communication with your primary care, whoever that might be, or your nursing agency that's coming in, or your physical therapist, or really anybody involved in your healthcare team. Effective communication just helps everyone to tailor those care plans to help you better support your loved one. If there's something that you think that I missed, please make sure to drop it in the comments below and share that, because we can all benefit as a community helping our loved ones and our persons with dementia. I will see you next week. Thanks for joining me, and I hope you have a great day.